In March 2020, the COVID-19 outbreak was declared a global pandemic. COVID-19 is a disease caused by a newly identified coronavirus called SARS-CoV-2. Our knowledge about the virus is still changing and developing, but we already know a lot. This new coronavirus can spread from person to person and appears to travel primarily through the air on the droplets and aerosols people expel when they breathe, talk, cough, and sneeze. A healthy person catches the virus by breathing it in or by touching their eyes, nose, or mouth with infected hands. Once the virus enters a new host, it latches its spiky surface proteins to ACE2 receptors on healthy cells, especially the cells in the lungs. There are more ACE2 receptors in the lower airways than the rest of the respiratory tract, so this coronavirus is more likely to latch on there. The virus hijacks the processes of the cell to replicate itself and distribute more virus throughout the body. Symptoms usually appear within 2 to 14 days of exposure to the virus. The 5 key symptoms of COVID-19 are fever, dry cough, shortness of breath, sore throat, and headache. Children may not have a cough or respiratory symptoms and tend to exhibit more gastrointestinal symptoms. People have also experienced fatigue, muscle and body aches, loss of taste or smell, congestion and runny nose, nausea or vomiting, and diarrhea. Coronavirus is most commonly diagnosed with a swab test. A long swab takes samples from the nose or throat and is tested for viral material. A positive result indicates that a person carries the virus at that moment. There is also an antibody test that can show if someone was recently exposed to the virus. More than 80% of cases are mild and can be treated at home, but the infection can become severe for others. The risk of severe illness is higher with increased age, and if someone has other health conditions, such as chronic kidney disease, diabetes, and obesity, among others. In more severe cases, the lungs might become inflamed, which can lead to other disease states, like pneumonia or acute respiratory distress syndrome. Anyone who struggles with symptoms at home, particularly difficulty breathing, should seek medical care. Severe symptoms may need to be cared for in the hospital. We don't know how long the pandemic will continue. It depends on many factors, and a lot of hope is pinned on the development of a vaccine and more effective treatment. In the meantime, everyone can do simple things to try to prevent infection. The virus that causes COVID-19 can be killed with simple soap and water. Frequent hand washing is recommended, particularly before you touch your face, mouth, or nose. Alcohol-based hand sanitizers can also kill the virus. Most viruses can live for several hours on surfaces. Cleaning and disinfecting surfaces is another prevention tool. Stay away from other people who do not live in your household. The recommended distance is 6 feet. This should keep you outside the drop zone of infectious droplets. Some people who carry the virus don't have symptoms, but can still spread the virus. So social distancing is important even when the people around you don't appear to be sick. Wearing a face covering is also recommended even when social distancing. A simple face covering can effectively curb viral transmission and reduce new COVID-19 cases, particularly over time. As this virus spreads from person to person, the best line of defense is to limit contact with other people as much as possible and use frequent hand washing, social distancing, and face coverings when necessary. I'm Dr. Suarez, and you're watching the eHealth Network. Stay healthy.